Hi, Carlita. Good evening. I'm so sorry. Can you listen to me?
Yes, yes, teacher.
I'm sorry. I was looking for a better signal. Okay. Talking about the articles, when you read a research article, which section do you read first and why?
The abstract. The abstract because it contains the main study, the main data of the article, and I think it's the first thing we have to read, because then you know if you want to read all the article, the entire article, or if you don't need it. So I think it's the most important.
Okay, the most important part for you. And in a case presentation, for example, what do you think makes a good presentation? For example, loudness of voice, eye contact with the audience, mm, body language.
I think the presentation, uh, the the communical presentation maybe, and yeah, not that the eye contact, but the way you talk with your audience. I mean, the volume of your voice, the tone of your voice. Because sorry, my dogs are a little
Mm,
crazy. I have four dogs, and I'm
or,
four, but my mother let her dog here for a few days, and so I have five.
oh,
Yeah. Well, the return to the presentation. I think if you are talking about some article about scientific topic or a social topic, it depends your audience. First of all, if you're talking with doctors, with health professionals, or if you're talking with patients, with people, so you have to change your language, the tone of your voice, how fast do you talk, and what are these communication material you present. So if you're talking with doctors, you can give some diapositivas. I don't know how to say that.
lights.
Slides. Sorry. So you could do the slides wherever you want with all the data. But if you're talking with people, with the patients, you have to be more visual, uh, giving examples, more graphics, less words, and you have to talk a little slowly, because people are going to try to understand what you're saying, and you have to talk in the language of the people in the region you are. So I think that's important, because many times we speak really fast in a technical language. People don't understand what are we saying, and I can bet that many times the patients go to to their houses, and they don't understand what we just try to teach, to explain, and about their medical conditions they don't understand. So they go to their house and looking for Dr. Google and try to understand what we just said.
Or to the pharmacist.
To the pharmacies, to their neighborhoods. Yeah.
It's worst. Yes, you're right. Okay. In your case, you have experience making a research of something, maybe an article or any study that you wrote?
No. I think that in 2017, before I do my postgraduate course, we wrote in I used to work in the um, I, I just forgot how to say cuidados intensivos. Intensive care unit.
Intensive cares.
Yeah, intensive care unit in the hospital, in the big hospital here in the city where I live. And
Mhm.
we make, I guess it was a description study about the antibiotics that people received during the
Mhm.
first 3 hours um, in the hospitalization here in Cuenca. And I am not sure if that article was I don't know printed, but it was expo. Um, it was presented in Congress, the medical congress of intensive care units in Vienna
Okay.
for my boss. Sorry. So after that, I did not wrote an article. It's kind of complicated because as a family doctor,
Mhm.
we work with communities. So anthropology, sociologists, they are better writing about the human. Uh,
Population.
yes, it's kind of complicated. Try to match health and sociology, anthropology. It's kind of complicated.
Yeah,
It's not
but
impossible. It's
yeah,
not
my
impossible. For
it's not
example,
easier that
no,
you can work with them and you can work together in some topics.
yeah, I was I don't know. I guess in 2020 I was talking with friends, with colleagues, and I was saying that Ecuador has not a good investigation because if you want to talk about anemia and
Mhm.
these social perceptions, Peru is the the best for that studies, for that social studies about these social perceptions of anemia. If you want to talk about mothers, single mothers, I don't know, motherhood, Spain is the best. If you want to talk about sexuality, Colombia is one of the best. So I did not find good articles from Ecuador.
Oh, but you can start with that.
Yeah,
Some people says no, everything is on an article right now, and maybe there's no chance to make a better job. But if you don't try, you
yeah,
won't know. It could be better than the others. So I think it, those studies would help people a lot. And since you are family doctor, you can help a lot of the community in your country.
yeah. Well, now I'm working with I don't know how to say this in English, but here in Ecuador we called Consejo Nacional de Salud,
Okay.
and here in Cuenca we have in Ecuador there are just three consejos,
Mm-hmm.
and here in Cuenca we have the best of Ecuador, and I'm working with the data of cardiovascular diseases in the private and public hospitals in the city. But also this week, I was working with an American man who lives here, and he had a heart attack years ago, and he was alone in the house. So when the 911 came, National Care Council, okay, so when the 911 goes to his house, sorry,
Mm-hmm.
they do not know what to do. So there's a program in the USA that it calls Yellow Dot, and we are trying to improve here in Cuenca Yellow Dot Punto Amarillo. It's the name
Mm-hmm.
here, and it is it works with data of the people that have pre-existence conditions like hypertension, diabetes, I don't know, the antecedent of a heart attack, and you put this, I forget the name of etiqueta. I was
Yeah.
yesterday, I just forgot. And well, you put this yellow dot
Mm-hmm.
in the door of the house, and in the other side of the house of the door, you have all the data of that disease, the allergic label. Okay, the allergic medication that the patient will take, some conditions, the emergency contact, and all these information are on the back of the door. So if the patient someday have some emergency, you call 911, and they see the yellow dot, and they know that in the back of the door they have information about the patient, and they could give a better assistance during the first hour, which is called the golden hour. So now we're trying to improve this in Cuenca, and I'm working with the health system and this council, I don't know, here in Cuenca, try to
Yes.
improve this project. It's more, I think that we could, as family doctors, we could work more in projects than in articles,
Yeah.
but projects are it's working with the people. So that's what I'm doing
Yes,
now.
but this is an investigation too. You have to put it on paper, write it down, and it could be helpful for your career, for other patients, to implement in another places, maybe in your country. So it will help you a lot. I think both goes together, the practice and the clinical, and on the other hand,
The investigation.
investigation. Yeah.
Yeah.
Yeah, it was so good, Carlita. Thank you so much
Thank you.
for
Teacher,
sharing.
I have a question. I'm so I don't know, loose. This is the last class. We have
Yes,
some.
this is
No.
our last practical class.
Okay, and
And on Monday is the final test. Remember to
Monday, what time? Because I have
at
a
8.
problem. I have a trouble. I had to travel, and I think I'm returning to my city from Quito, from the capital. I don't know if it's 18:30. I don't know the time of the flight, and I think I'm gonna have some trouble with that.
Okay, maybe you can write on the chat on WhatsApp, and we'll find a solution, okay?
Okay, please. I'm sorry. I have to go.
No, no worries.
Okay.
Take care.
Thank you
Have a
very
great
much.
night. Bye-bye.
Bye.
Thank you. Hi, Mateo. Good evening.
Hi, teacher. Good evening.
Sorry. Okay, Mateo. Did you do any investigation on your experience, on your past experience, or maybe lately?
Yeah, I do. In med school, I try to do an investigation about an early marker for hemorrhagic hemorrhagic cystitis. And for my rural service year, 3 months of rural service, I did an investigation about the incidence and prevalence of COVID-19 in Tiquina.
Okay, and how did it go?
Now it go really well, because the doctors there didn't register the total quantity of patients to the system. So for my work, I had to do it, and we had a really good vision of what was happening there. in COVID. Before I arrived there, the 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 governor, the
Yeah.
governor didn't take a lot of importance in that region. But when I upload the the total of the data, they gave us more vaccinations, more uh, nasal antigen tests, more rapid tests. So it was good. I did it, and there was a good response for the coordination.
Okay, so you did a good job then. That's a
Yeah,
good. Which kind of investigation you would like to do in the future?
in the future, I would really like to do a clinical trial for some new drugs, or to compare drugs to see which is more efficient. In this case, I would like to maybe compare two or three types of therapy against cancer. That would be really, really good. I don't really have planned an investigation recently, but that's like a
Wow. Yeah, that's really interesting. Okay, I heard, I don't know if you heard about it, that Losartan has been retired. I don't know.
Yeah, I heard about that. Um,
Mhm.
it's because you can't give losartan to pregnant women, and there are a lot of other drugs from the same family, like vansartan or other drugs that has the same mechanism of action, that have less adverse effects. But for non-pregnant women, it has very few adverse effects. Commonly, they have a cough, and a radiation-induced cough,
Mhm.
and that's the most common adverse effect. It's a little annoying, but that's not a big deal. So it's still safe to use here,
Okay, yes,
unless you're a pregnant woman, of course.
understood. Okay, perfect. And when you read a research article, which
Mhm.
part do you read first and why?
Well, first of all, is the title. I have to know what is the article trying to tell me, and then the results. I mean, a first rapid lecture of the abstract,
Mm.
and I read then the results. I emphasize the results because I want to know. I want to have a rapid vision of the results that the researchers or the investigators obtained.
Mhm.
Then the material and methods, and that's pretty much the most important thing. And the discussion is at least, but the results and how they obtain the results are the most important. I think that the things that they teach us uh, in our schools, like a theoretical background,
Mhm.
or I don't know, justification
Justification.
justification is not that necessary. If it's necessary, it has to be just one paragraph, not two planes of copy and paste things, but
Yeah.
that's how they write the articles in around the world, the best articles around the world.
Yeah, that's right. I agree with you. Well, in a case presentation, what do you think is important? For example, the loudness of voice, the body language. What kind of things do you think are important?
If you have a presentation as a help, I think that one of the most important things is that the presentation has to be clear and concise and not overwhelmed with too much letters and words that doesn't uh, help the audience in understanding the case. Second, as you told, the presentation of the presenter and the loudness of voice, the security of what you're talking about, and good fluency of the case. You know, it has to flow very very natural. It doesn't have to be like with some I don't know, some pauses and or you're not sure what you're talking about, so you don't get yourself to understanding and theoretical framework. Thank you.
Yes, that was. Okay, perfect. And well, I don't know, in your case, how did you do or how do you make a presentation case?
The case presentation. First of all, the affiliation, like the sometimes the name, sometimes it doesn't matter. Most of the times it doesn't matter. The age, sex, the region that the patient was born, some pathological antecedents, yeah, and some non-pathological antecedents, some behavioral
Social
like their behavior costumes, yeah, and then I present the how the patient has arrived at the consultation, what he was referring, what I found, what what complementary exams I have. My God.
You asked for?
Thank you. I asked for, and what the results of that exams were, and then a conclusion. I have the conclusion and the plan of treatment that I'm going to administrate, or what I'm gonna do if I have to refer the patient or treat it by myself.
Okay. Thank you so much, Mateo. It was complete and good. And well, since this is the last class, I hope you have a great test on Monday.
Thank you, teacher. Yeah.
And see you around. Of course, we will see you on Monday, but you were one of the best students, so I will miss you.
Thank you, teacher. I will miss you too. that was a great experience to have this course.
Indeed, thank you so much for the explanations you gave me about some topics that I didn't know. It was so good. I know you will be a good doctor, a better than now. Okay, and then I hope
Thank you.
to read your articles and your research.
Thank you, teacher.
Okay, see you on Monday.
It was so nice to meet you.
Nice to meet you too. Thank you. Bye.
Bye, teacher.
Hi, Jorge. Good evening. Hello.
Good evening. Can you hear me?
Good evening, Jorge. Yes, now I can hear you.
Okay. Okay, my computer is crashing again. I don't know what's happening. Thank God it's ending the classes. It's at the end of the course. Yeah. I don't know what's happening. I think it's maybe a virus or something.
Yeah, you have to take it to the technician.
Yeah, I have to clean it.
Yeah. Okay. Talking about articles, Jorge, do you have any experience writing one, or maybe making a contribution?
Yes, actually, I have one totally authored by me, and I have two published as a co-author. But the one I written is the one that I think I could talk about the most, because the other two ones were like more kind of small details to fix. Then, and that was my contribution, but my name's there though. And yeah, so writing an article is really tough when you're not used to it. When we were in med school, they were like, yeah, it was a requirement. For example, for in our second year of med school, like the final exam, for example, for microbiology, was writing an article regarding any topic you want to I don't know, to investigate. And we did retrospective article. It was a like kind of case report, and that's what I did lately after being a medical doctor. I did another case report because those are the easy ones. I think they don't take a lot of time. They are like they're important to it. There's no background of other research papers regarding that topic, and yeah, it's really hard when you have to submit the article for web page where they publish the articles, and you have
Theoretical
to check.
framework,
Excuse me.
the theoretical framework, and
Yeah,
the
everything. I mean, the all the like the structure of the article, like it has to follow some requirements to be admitted and to be submitted. And I think that's the tough part. So when you're published, you feel yourself like really happy because it was a long work. Actually, the the last I did, the last I written is still being still on revision, but the ones I contributed with, they're already published, because there is a guy in the US. Actually, I work with physicians in the US, and there's a guy who's a medical student who works with all the structure parts, like that's his job, because he's a contributor too. And we, the physician, make like the science perspective, if everything is right, if everything is written correctly, if there is some logic regarding all the parts of the article. And yeah, that's how I publish. Actually, my name is in two articles. One, both are almost the same topic. Both are outreach from. They're like a kind of foundation
Okay.
of two physicians in the U.S. One is an oncology neurosurgeon, and the other one is a pediatric neurosurgeon, and both have a foundation, and they sometimes make donations and that stuff. So both articles talk about that. Talk about, for example, the first one is in Lima, Peru, which was like a course. A course of guiding how to use a neuroendoscopy machine, and it is a 15-year appraisal. So it is from 2003 they started this, and they ended like 2019 due to the pandemics. So they're really interesting, and it's really easy for them to do it. It's like, okay, you do that, do that, do that, and everything's published, and they're like getting more and more and more papers published. But yeah, it's hard work. I struggled a lot when I wrote on the paper I did about epilepsy, and I think I fixed it like 8, 9, or 10 times. Yeah, it was awful
Mm,
doing
yeah.
all the charts that have to be correlated, the bar graphics that correlate with the charts. All the information must be like everything must be like everything must have a background. Everything has to be like based on something. You cannot like write what you think. It must be based on something. So yeah, it was different experience, but it's how the career is going to be we have to publish and publish and publish a lot.
Do you think this can help you to, or maybe make you able to make another article soon?
I hope so. I hope so, because I must have a lot of publications to apply for residency in the US. So I think after finishing this course, I'm going to take another course regarding research and statistics, because I'm lost with that. I actually
Really
not lost,
useful.
but yeah, but when we were in med school, it was, I think, the second year that we studied that, but it was many years ago, so I don't remember exactly all the things you have to do, the Excel, the formulas, all the stuff.
Yes, it's really hard, especially
Yeah,
when you make an specialization, or maybe another master or something. It's so hard for us to make after university, and you didn't use it, and so your mind is in
that's true.
another
Yeah,
place.
yeah.
Yeah.
I think that everyone that does a postgrad study, any kind of postgrad study, they must do research. It's a must.
Yes, that's right. Okay, and what makes a good presentation in your opinion? I
Okay,
mean,
I think there
tone of
mhm,
voice and everything.
there are a lot of things that can help to what is your intention in a presentation, is that the public understands what you're trying to say. So for them to understand what you're trying to say, you must have all your all the topic you're talking about under your complete power. Let's say you must know everything. You must be self-assured when you talk, and of course, talking loud whenever a word needs emphasis.
Mhm.
Whenever you are talking about something important, you have to raise the voice. Also, body language is really important, because you have to show everyone that you're like under control of what you're talking about, and you're ready to explain anything they can ask regarding your topic. So there are a lot of things that are important. Yes, talking loud. I think, of course, do not making that presentation like flat, like not talking like when as you're tired. You have to play with your voice intonation. You have to whenever, I don't know, for example, if you're in an auditorium, you have to play with your environment,
Mhm.
walking everywhere. Like, if you see that people is not like paying attention, you may ask some questions too, and make the people participate, so it's going to be like more interactive. And that, I think, that makes a good presentation. That makes that what you're intending is that they get the information you're giving. So there are a lot of things that are going to help people get information.
Okay, perfect. And do you think it's a little bit tough to make a good presentation on this how can I say, in on this way, for example, by Zoom, or rather than in person? I rather in
Yeah, I
person
think so. I think it's
better.
yeah, yeah, I think so, because when you're on a video call, it's not that interactive. You may ask, for example, people to participate, to give their experiences regarding us, as you do sometimes in classes, but you don't know what they're doing, because they're with the cameras off, or they're not there. They might be, I don't know, eating or drinking something, or doing something else, while they are in the video call, but they're not like paying attention as if they were in an auditorium. So I think it's harder
Yes.
to make like class interactive, or yeah, or get or let the people get a topic. It's much more harder, I think. the pandemics made stuff harder in general for regarding learning and teaching.
Yes, that's right.
Of course,
we have to adapt, but yeah, I think it's better when you have people in front of you and you, as you said, you make an interaction with them.
Of course, yeah.
Thank you.
So different.
Yeah. And the last thing, can you present a patient with all the details we already saw yesterday?
Okay, so what a patient presentation must have is, of course, the gender, the age of the patient. For example, male, 40-year-old male patient. The occupation is real important, as we saw yesterday. Yesterday was a plumber. It can be, I don't know, a driver. How the patient appeared, how the patient shown. It was, if it was in, I don't know, emergency, or he shown in general consultation. What a patient referred, for example, this patient referred headache, referred nausea, vomiting. And what also is important is to tell the time when it started. For example, the patient refers a headache 2 weeks ago. It is a male patient, as I said. After what happened, for example, after a car crash, and he lost consciousness, for example, and now the headache persists. After that, in this case, if the patient was admitted, you have to tell, I don't know, if what medications he received, what was the treatment, how was the evolution of the patient, if he's getting better, if he's with the same symptoms or signs. And yeah, I think that would be almost everything. For a brief presentation, or brief patient presentation, for example, a bedside one, when you have to do the war rounds. And yeah, I think
you can put the diagnose and the treatment.
Oh, can you repeat it again, please? I think it was...
You put the diagnose and the treatment too?
Yes, at the end, of course, if the patient is like admitted to the hospital, you have to say, I don't know, the patient is receiving, for example, I don't know, tramadol, due to the, he of course, also the
Uh-oh. Hi, Jorge.
Okay, can you hear me?
Oh, yes,
okay.
now.
I think I sent the
Yes, I have it. Yes.
Okay, perfect.
Thank you.
Okay, it didn't crash. So what I was saying, yeah, you have to ask also, I don't know, I mean, I'm not asking, you have to say if the patient has a CT scan, for example, if he received a treatment, if of course, what the diagnosis is based on your what you talk with the other physicians, or what is your opinion on the diagnosis. And I think, yeah, that's it.
Okay, yeah, that was good. Thank you so much. Since this is the last class, as I told Mateo, I will miss you guys because you
thank you
gave
so much.
a lot of information, and that is helpful for me too. Okay.
Thank you.
And don't forget to make your practices, please, Jorge,
Yes.
for Sunday.
Yes.
And see you
Thank you.
Monday. Okay.
Okay, thank you so much for everything. And the class was great. It helped me a lot for speaking and like to let words go. That's something I told Mateo. It is really important because we both are planning to go to the US, so we must like be really used to speaking English. And of course, when you don't have anyone to speak in English and you don't have like a reason to speak in English, it's more difficult. So yeah, thank you for everything, and it was a great course. And okay, I'll see you on Monday for the final exam, right?
That's right. Okay. Thank you so much. See you. Take care.
Goodbye.
Have a great day. Bye-bye. Hi, Rina.
Good evening, teacher.
Good evening. How is everything?
I'm fine.
Can you listen to me?
Yes, teacher. With a little interference, but yes, I can.
Then I will turn off my camera. I'm so sorry.
Okay.
Okay. Rina, when you read a research article, which section do you read first and why?
Could you repeat me the question, teacher?
Of course. When you read a research article, which section do you read first and why?
I read the substract because
the abstract?
The abstract, yes. I read the abstract because give me the a review about the article. For that, I read that part first.
Okay, that's good. And in your opinion, what do you think makes a good presentation? For example, loudness of voice or maybe body language? Or what do you think?
Okay, for a good presentation, I think it's the kind of language I have to use. But it depends, of course, about the area. For example, a presentation in the health area, it's very important to use a language, a technical language, or in a polite way.
Okay.
Yes, and the another part important is use vocabulary, how to say, a vocabulary using the scientific method or método científico. Yes.
Scientist method.
Scientist method.
Yeah.
Yes.
Okay. Okay, that's good, Rina. And did you have any experience writing an article or maybe making a research?
A little about both.
Okay.
And
can you tell me your experience?
Okay. The first one is it's when I am in the process for the graduation. I have to make a thesis. That is kind of researchment. So it was well, the process was very detailed because it's very organized. The system that all the researchment has, because I use the scientific method. So there is it's a group of steps, very organized. It's a very precise because it's the step 1 to step 10. I remember, and I remember I made first and then a I don't know, that is a project or un anteproyecto or
pre-investigation?
I'm sorry?
A pre-investigation?
Okay, a pre-investigation. Because it's the first part, only theoretical, that I have to defend why I want to present the idea for the researchment. The idea, it was about the pregnant woman associated with the urinary infections in a specific area in my country. And when that is the first time I had to wait, because I need a little group of experts accept the idea or accept the project. After that, it was the process of the experiment, and that part I went to the area or the clinic, because it was in a clinic that I had to recollect information through questionnaires and interview.
Okay.
And the thesis, in fact, after that, the thesis, I think the complicated part is have all the data and process the data using a software. I use the software EpiInfo.
Oh, thank God you had a software.
Yes. EpiInfo is very useful, but at that moment in the time in my life, it was very complicated to use it. But at the end, when I defend the researchment, all was very good, because I, thank God, passed the thesis. And yes, and another part now, or years ago, I wrote an article, and that article, it talk about the COVID, a little researchment about COVID at the beginning. Yes, at the beginning, and that article had a little focus or a review about the attitude for the persons, because the pandemic was an item very, very new in these times. And my researchment, or my article, it was a little bit about the history and about how the people react in front of pandemic like COVID. And yes, that was the article. And I went in the article, the parts are very similar, but in this article, and especially, it was more about una revisión bibliográfica, because I have to research a lot of about the experience in another page, for example, the WHO or the OPS, because the COVID, it was a new disease.
Yeah. Okay, so it was a research, a review of an investigation, you said. It has less theoretical framework. There you go.
Theoretical framework. Yes.
Yes, it's a marco teórico. Okay.
Yes. Okay. Thank you.
Okay, that's so good. Interesting. And now you maybe think to make think about to make another research, or not yet?
Yes, in the future, I hope so. At the end of the year, I have to think about to prepare another thesis, because I am studying a master, and if that thesis or that researchment, I want to I want to do about the health politics or about the public health.
Okay, that's a good one.
Specific. Yes.
Okay, perfect. Okay, Rina, thank you so much. It was so good to talk with you those months, and it was nice to meet you. I think you are one of the best professionals. Okay, you always explain to me in a complete way, and that's a good thing. I know you
Thank
are good in what you do, so I hope you can be successful more than now in the future, and maybe see you around. Okay.
Okay, teacher, I hope so. Nice to meet you too, teacher. It was a good experience, excellent experience to stay in this course, a little course, because 2 months it's a little short time.
Yes, I think, especially to practice where we have to practice, right?
Yes, teacher.
But it was a great time with you. Don't forget to make your practices, Rina, for Monday, please, and to well, see you on Monday too.
Same schedule, teacher.
Same schedule, 8 p.m. please.
Okay.
Oh, just 1 minute. Okay, one more and I'll let you go. Thank you so much. And have a great night.
You too, teacher.
See you
Thank you.
Monday. Take care, Rina.
See ya.
Bye-bye. See ya. Hi, Jocelyn. Good evening.
Hi, teacher. Good evening.
Can you listen to me well?
Yes, teacher.
Or you have some trouble with my connection?
Le estaba escuchando bien, pero luego se entrecortó.
Okay, I will turn off my camera so you can listen to me better, okay?
Okay, teacher.
Okay, Jocelyn. Do you have any experience making an article or maybe an investigation?
De ahorita venir. The truth is that I did not have the opportunity to write an article. But I did have the opportunity to do research work in the rural service.
Service.
What, teacher?
Service.
Service.
Yes.
Okay, so service at my internship.
Okay. Okay. What kind of research did you do?
Teacher?
What kind of research did you do?
The the um, the subject that you do is the risk of arterial hypertension in older adults.
Okay. Can you tell me more about your experience?
Teacher?
Can you tell me more about your experience?
Okay, teacher. For example, the objectives of my work determine the risk of hypertension in older adults. The designs was a retrospective analítico, ¿cómo se dice, teacher? Analytic study. The result from the age of 16, you are at the rate of suffering from hypertension. Conclusions: the people just have underlying disease, have a higher risk of hypertension.
Okay. Okay, and when you read a research article, which section do you read first and why?
¿Cómo, teacher?
When you read a research article, which section do you read first and why?
Yeah. The first I think read the summary.
Okay, the summary.
Because it makes my understand what the article is about.
Okay. Okay. And when you see a presentation, a case presentation, what do you think it makes it good? Maybe the loudness of voice, the body language. What do you think makes a good presentation, in your opinion?
Yeah. I can present. Me dijo, no, teacher, que cuál es la parte más importante de un artículo, ¿no ve?
No. What makes a good presentation, in your opinion? What makes a good presentation, in your opinion? ¿Qué es lo que hace una buena presentación, en tu opinión?
Ya. Yeah, okay. For me, the important parts are the title which should be short, concise, clear. Also the introduction to the summary, the material and methods.
Which kind of material?
A material. Yes,
but which kind of material? I couldn't understand. I'm sorry.
Okay, teacher. Applied.
Jocelyn, una consulta. ¿Qué clase de material?
La recolección de datos.
Data recollection.
Data recollection and methods applied and the discussion. Teacher, discussion and conclusion, research for the article.
Okay.
Teacher, What is the difference in research and investigation, and when we use?
Okay. An investigation, it's a word, es una palabra, investigación, que nosotros podemos utilizarla para hacer referencia al uso de datos o el compilado de datos, ¿ok? Y el research es buscar información, en este caso en diferentes artículos. Es casi un sinónimo.
Okay, teacher, thank you.
No problem. Yes, it's like a synonym. I send it to you and I erase it. Can you do it again, please? I'm so sorry.
Okay, teacher.
Gracias, Jocelyn. Ok, no olvides hacer tu práctica, por favor, para el día domingo. Y el lunes a las 8 vamos a dar el examen, ¿ok?
Okay, teacher.
¿Tienes alguna pregunta?
No, teacher.
Ya. Y la práctica hazla, por favor, con el libro. Revisa el
Okay.
libro, te vas a acordar todo eso, ¿ya?
Okay, teacher. Thank you.
Okay. Thank you, Jocelyn. Have a great night and see you on Monday.
Goodbye, teacher. Take care.
Goodbye. Take care. Bye-bye, Jocelyn. Hi, Weimar. Good evening.
Good evening, teacher.
Okay, Weimar, do you have the chance to make a research or an article?
Teacher,
Do you have the chance to make a research or an article?
yes, teacher.
Sí.
de investigación, a ver, teacher.
Yes. Or an article. I don't know if you made it.
Mm,
Do you have the experience to
yes,
make
teacher, yes, teacher.
research?
Una oportunidad. Sí hice alguna vez una investigación, teacher.
Okay. Tell me more about it.
Yes, teacher.
Hmm? Okay, tell me about your experience.
Les explico, teacher, sobre
I want to know.
mi experiencia. Yes, teacher, I did some research during my training. It was about the use of diamine and vitamin C in patient with sepsis.
I'm sorry, what do you use? It was an antibiotic?
Tiamina y vitamina
vitamin.
C. Vitamin.
Vitamin C. Okay.
Vitamin
okay,
C
go ahead.
in patients with sepsis.
Okay.
My approach to the problems was what is the effectiveness of vitamin C and diamine in increasing survival and improving the evolution of patients with sepsis in intermediate therapy.
In intermediate therapy. Okay, that's good.
Therapy intermediate.
Yes. Okay.
In the results, I made the charts, graphs. The most important thing was the discussion in conclusion, because everything had to be correlated.
Okay.
Eso, teacher.
Okay. That was good. And when you read an article, a research article, which section do you read first and why?
Teacher me dijo que cuando leo un artículo, ¿qué sección más importante o
Which section do you read first and why?
más importante? Entrecortado salió, teacher, la parte última.
Okay, I will turn off my camera so you can listen better. When you read a research article, which section do you read first and why?
Okay, teacher. The first is the statement bueno, de un artículo, ¿qué sección leo más, teacher? Más o menos así lo entendí. O me
Which
dijo que...
section do you read first? ¿Qué sección lees primero?
Ok, sí, pensé que me... Ok, teacher. The first is the statement of the problem after formulating the problem.
The main problem?
Formulación del problema.
Okay.
Well,
problem formulation.
okay,
I think it's the main problem. The main problem it's better. It's better. El problema principal, ¿no? La formulación del problema.
Then the general objective of an interesting topic.
Okay.
Then the specific objectives which are very important to develop the research. Develop the research method. Discussion, results, and conclusion.
Okay. Okay, there you go. Problem formulation, okay?
Okay, teacher, problem formulation.
Formulation, yeah. Okay. And in a case, in a presentation of a case or case presentation, what do you think it's important to make it good?
Teacher, le presento un caso, teacher, cualquier enfermedad podría ser.
Okay.
Diabetes mellitus type 2 is a disease with high morbidity and
high morbidity.
Morbidity
But high.
And
you said high. Okay.
High.
Okay.
Teacher. And mortality associated with risk factors.
Okay.
Objectives. The objective of the study was to analysis overweight or obesity, diet and smoking is as risk factors in older adults from medical clinical and in design en diseño in
Design.
Design teacher
Design.
design
De nuevo. Design.
design
Yeah.
Observational cross sectional analytical and retrospective case control study was carried out in 628 patients.
Okay.
It was found that the risk factors diet and smoking are associated with the higher occurrence of DM2. So it was concluded that they are considered risk factors, while with overweight or obesity, the association is not statistical significant.
Okay, Weimar, thank you so much. Gracias. Nuestro tiempo ha terminado. ¿Será que puedes llenar, por favor, el cuestionario? No te olvides que tienes que hacer tu práctica o tus prácticas, ¿ok? Para el
Okay,
día
teacher.
de domingo, ¿verdad? Y el lunes el examen a las 8, ¿ok?
Okay, teacher. Thank you. Goodbye.
Thank you. Goodbye, Weimar. Take care. Okay. Ale. Good night.
Good night, teacher. How are you?
I'm fine, thank you. How are you?
I'm also fine. Everything's good. Thanks God. So
That's so good.
yeah, thank you.
How is everything in your house? Nobody had COVID after you had?
No, thanks God. Anybody?
That's good.
Yeah, it's perfect. I was afraid for my grandparents because they have chronic disease.
Oh, but they are well.
But yeah, exactly. They are really, really good.
Okay, that's good to know. Vale, when you read a research article, which section do you read first? And why?
I read the title,
Mm-hmm.
to like have an general idea of what's the article about. Then I always read the summary.
Okay.
Because in the summary it's everything, the abstract, the theoretical, how do you say that? Marco teórico.
I will write it down again. um, theoretical framework.
Theoretical framework. Then it's the results and then the discussion. But in the summary, you have the everything in a short way, so you can see like a global idea of the article, but in a short paragraph.
Okay. Okay, perfect. And in a case presentation, what makes it good? What happened?
I hate
Case presentation.
yes, but I think the most important things in the clinical cases is the discussion.
Okay, but when
Because
you presentation, you put the discussion too.
oh, I don't know if in all clinical cases they put, but for example, in my case, when I go to the rural area and also in the internship, we have to like present clinical cases and we have to put the discussion.
Okay. Okay, and do you think it's important the loudness of voice, the body language, for example, or the eye contact? I don't know.
I think it's important. It's important the words that you say because it's a presentation, so you have to use the formal words or appropriated forms to say things because is you are presentation your case not to your friends. You are doing for doctors or for your teachers, and in most of the case the person are older than you, so for respect you have to use like formal words or phrases to present to do the presentation. And uh, one person told me that it's important the movements you are doing with your body or with your hands. I think it's important you have to stay like straight and you can use your hands but not too much.
Yeah.
It has to be like in a appropriate way, like I don't know,
Yes.
maybe this or that, but not like all the time because
Like dancing.
because the person that are listening they distract about your moves and they don't listen what are you talking. And also it's important the loud, if it's loud or not, because if the person is not listen to you they will not understand or they will lose the interest in interesting no
Yeah, interest.
interest. They will lose the interest of what are you saying.
Okay. Okay, that's a good thing. I am agree with that. People can get distracted with your movement. So we have to be careful with that. Okay,
Also,
so
when you're talking with a lot of people, uh, one time when I was in the school, a girl start talking and she talk and say, "We're gonna do this." And we also we want to this. And she said like 1,000 times, and everybody
it's a
start
little
laughing.
bit annoying, you know.
Yes, and I was like, what? And uh, you are more you prestar atención. You
Have to take attention or put attention on what you're
uh,
saying.
thank you. So you are taking attention more in this in the that's the phrase that she was
Trying
saying.
to cut it down. Yeah, I know, I understand. And I say it sometimes, a few times, I think, maybe just to make a little pause while I'm thinking. So, but it's annoying, I know. We have to cut it off.
Yeah, sometimes yes, because sometimes you lose the idea or you lose the world, the
Yeah.
word, sorry, the word, but not all the time.
Yes, that's right. Do you have any experience making a research or an investigation?
No,
No?
I don't know if you can say like a real investigation,
Monography.
but
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 you made a
yeah,
monography.
yeah,
Okay,
we
that's an investigation.
okay, we everybody had to do in the 3 months of rural area.
Yeah.
Is the your final investigation work?
Yeah.
So I don't think you can say, "Oh, yeah, it's really an investigation," but you have to do.
Yeah, it's more like practicing because I don't know, but mine wasn't so good either. If you're thinking so of yours, but I think it's a good way to start practicing because when you have a postgrade, you will have such a big deal with these investigations using the all the steps we saw yesterday besides the um, the APAS norm or the Vancouver norm. You have to, yeah.
Them. There are a lot,
You have
and
to read about it now
it
that you
doesn't
have
make sense.
time. Yeah, that's annoying too. But if I can suggest something, is to read more about that before you start an investigation. So you will be under pressure and you won't understand what you're reading or watching. Okay, so maybe you can get into YouTube and look for APA's norm or Vancouver's norms, and you will find everything there. It will help you a lot.
Yeah, I know. Also, thanks technology, there's a lot of things. I I was really afraid about the Vancouver norms for bibliography, but
Yep.
then I found two pages on internet that you put the bibliography and they transform to Vancouver norm.
So
I
easy.
think you can find everything on internet, everything you want.
Yeah, but you have to be careful because if you don't know if it's
Ah, yeah.
exactly the thing you're doing, I had this experience with my thesis of the master where I did it, and when I send it, I submitted. My tutor told me that I have to make I have some mistakes there. So I have to make another research and find out that I have some trouble with this APAS norm. And that's why I tell you because I used that and it was bad.
Thank you.
It was like
Thank you.
I was robbing all the information of those authors, and I felt so bad about that, like a child. Yeah, it was so embarrassing for me, and
Yeah, I understand.
not because they knew it, just because they had a software where they put the information, and the software they turn everything red if it's like something is stolen. But can you imagine? My whole work was red, and I was no way. So
Yeah,
I
I
had
know.
to do
I
it again.
know. I know.
Yeah,
Yeah, that's why I'm telling you can do anything on internet.
that's right. Okay, Vale. And the last question: can you make a case presentation?
Now in this moment.
Yes. maybe just a few things and the most important things, or maybe you can tell me the steps you will use.
Well, first, for a presentation, I think it's important to say good morning, good day, good afternoon, or I don't know, even the time. Then you have to say your name, and then you have to say what are you, or the topic that you will present
Presenting.
I'm sorry. Then you, I think it's important start like if you are presenting a clinical case, it's important to say the information of the patient, like the patient, like the age, the sex, if it's female or male. I think it's important, nationality, and if he or she had illness, or if maybe in their family they have like an hereditary illness like diabetes or something like that.
Hereditary.
Okay. Hereditary illness. And yeah, then I think
social history, family history, remember, personal details. What else?
personal details, social history, you could say family, personal and family pathological history, allergics. Well, I think it's depend or which type of clinical case. Like our final test, it was to, like, you have to discover what has the patient. So yeah, you have to say like the personal details, social history, pathological history of personal and family, and then you have to say like the cause of the consult, then the symptoms, the history of what happened, and then like it goes to the examination, and then the diagnosis and the treatment.
Okay, that's a good thing. It was almost the same steps we saw yesterday. Vale, that's good. Okay,
Sorry.
so please don't forget to make your practices until
Until Sunday.
Sunday, and on Monday it's gonna be the final at 8 o'clock. Okay.
Okay, Monday at 8. Okay, okay, teacher. Thank
Thank
you.
you so
See
much.
you.
Have a great night. See you on Monday. Bye.
Okay, goodbye.
Bye bye. Thank you. Hi, Sergio. Good evening.
Good evening, Miss Encinas. I'm right now
Are
like,
you
yeah, I'm like waiting for the my other courses professor like to finally just say goodbye to everyone.
okay? No worries.
But
Do
I mean,
you need
we
any
can.
2 minutes?
No, it's okay. I mean, we can start, but if I mean if he says like goodbye, I just need to say good night, and that would be it. But we can start,
Goodbye.
no problem, because we were like ending the class.
Perfect. Well, I want to know if you have any making an article or publishing something or a research.
Actually not, but I'm like part of a research project in which like principal investigator will eventually write a article about the research project we are now working in. So yes.
Okay, can you tell me more about your investigation or research?
Yes, of course. It's the one I've been telling you.
Yes, I
I've
know.
been
I
I've
remember.
been sorry. Yes, it's sorry. It's just someone started talking in my course. So, yeah, it's
No
the
problem.
one I've been talking to you, telling you. Sorry about the.
Buenas noches, todavía vamos a estar en sesión.
Uh-oh.
Just hold on for a minute, please.
Continuamos.
Yes, of course.
Okay. Thank you, Ms. Encinas, for the patience. And sorry, everyone was saying goodbye.
No problem. I understand. Okay. You were telling me about your research, and the truth is that I didn't have the chance to listen you very well last time, so I would like to listen now.
Oh yeah, no problem. The research project is about looking for new ways of diagnosis for HIV patients related to diagnosis methods that involve nanoparticles. So it's like a new way of diagnosing HIV through nanoparticles with urine samples. Like the majority of the patients, the HIV patients are co-infected with Chagas, toxoplasmosis, tuberculosis. Those are like the principal ones, the ones
Oh,
we test for, and the one the project tests for free as a help to patients that like don't have too many money or like are poor or live in low income countries or are from or come from rural areas. So yes, that's the project. That's what it is about. And yes, I mean my work or what I'm in charge of is recruiting or enrolling patients for the project.
wow, such a great investigation. It's a complete scientific investigation. You work with a lab and everything. It's really good.
Yes, it is. And I mean, the principal investigator is a is a great guy that has lots of experience in the research field, like starting many years ago. He's a professor at Hopkins University in the US. So yes, he's like
That's
otherworldly.
interesting.
Yeah.
Okay, I'm losing you. That's why I'm gonna turn off my camera, okay?
Okay, no problem.
Can you listen to me well?
Yes, like without any
Okay.
problem.
Okay, I had trouble listening to you, and now I think it's better. Okay, another question. When you read a research article, which section do you read first and why?
I guess I read first the abstract, and it's like one of the things we learned last class, right? But most of the times I read the abstract because it's like a summary of everything, and it's a part of the article that gives you like a broad idea of what it's going to be about. If the article will like catch my attention or not, if it will interest if it will like match any interest I have at the moment. So yes, that would be like the first part I would read
Okay,
if I see an article or if I'm looking for one.
okay, perfect. And in a case presentation, what makes a case presentation good in your opinion?
What makes it good?
Mhm.
Probably it would be how clear it is and that everything makes sense. That every piece of information that is given by the doctor or the training doctor or the one that is describing the case describes every piece of information in a clear, probably short way, or the most important things that have to be given. But at the same time, it has to be complete, right?
Yeah.
So yes, probably that would be it. That the information about the patient is correct, that its history is correct, its social family history is correct. Um, uh, how was it called? The history of present illness, I guess it's called.
Yes, it is.
It is described like in a very clear way, and it has like the most important details mentioned about the patient, about why the patient was admitted to the hospital or why did he or she come to the consulting room.
Okay, and thinking about loudness of voice or body language, do you think it's important?
And like talking about or regarding the patient or the doctor.
The doctor who is making the presentation, or or the speaker in this case. Do you think it's important to have presence?
Oh yes, it's very important since that will influence a lot in how the patient answers, or if the patient has enough trust in the doctor, like uh, to say more things about how he or she feels, or if she or it will help the patient also to show the doctor if she or he has any lesion of, or if there's something like very personal that he or she is hiding, but because of how the doctor presents everything and how he explains or she explains everything, gives the patient like enough trust to express him or herself in a in the best way possible. Yeah.
Okay, perfect. And the last thing, can you present a patient with all the details we already saw yesterday?
Oh, well, I can try to remember every detail.
Well,
Mention, yeah.
maybe you can mention the important things, because you, of course, you know how to make a presentation, and it was similar.
Okay. Can I try to remember the parts first of how you present a patient? Um, I remember there was like a formal way and a more informal way, right? Uh, but like the basics, the most important things that have to be mentioned. First, it will be like first explaining who's the patient. Like uh, this is Mr. Rene Castillo, a 34-year-old patient who was just admitted to the hospital 2 days ago. Uh, he came, he was admitted or he presented the following symptoms. You could say um, breathlessness, or is it short of breath? I don't remember exactly how do you call it. But you can explain like other symptoms also if he had also cyanosis or um, his respiratory rate was increased. Then you can explain the part of of his social and family history, I guess. Social history would explain, for example, if he smokes or how often he drinks alcohol. Um, where where does he work in, or what does he do for a living? Uh, and talking about his family history, you would have to explain a bit if any of his siblings or parents had any disease in the past, or right now they have a disease. For example, if one of them has cancer or um, high blood pressure or diabetes, for example. Um, Now, just after that, what else would you have to mention that is important?
Diagnose and the treatment.
Oh, yes, diagnosis and treatment. Exactly.
Okay, Sergio, that was good. Thank you so much. And remember, please, to make your presentation, your practices for Monday, Sunday, and the final test at 8 o'clock. Do you have any trouble with the schedule?
No, I mean,
Monday?
oh no, this Monday? You're talking about this?
Yes, this Monday.
No, actually,
Okay.
I mean, at 8, we would have the exam, right? It will
Yes,
be like from
from
8
8
to
to
9.
9. Exactly.
Oh, okay, and it will be like in the same way as the last exam?
Yes, it will be the
Oh,
same.
okay, perfect. No, I don't have any problem. And that would be like the final exam, right?
Yes, it will be the final. And Sergio, thank you so much for your participation. It was such a pleasure to meet you and have you in my class. I know you made everything that was on your hands to participate and to be at the right time in every single practice. I know you can't a few times, but it was good. Thank you so much for that
Oh no, thank
effort.
you. Thank you, Ms. Encinas, for having like too much patience with me and for everything and for your time and consideration. So thank you. I'm the one that is grateful. So so
Thank
yes,
you.
I guess we'll see each other like on Monday and yes, I hope you have a great weekend.
You too. I know you will be such a great doctor, better than now. You will be successful more than now. So keep on that research, and I will waiting for the results.
Thank you so much. And yes, I hope I can be as successful so that I can also help others, because that's like the ultimate
Yes.
mission in my life, to help others. And thank you so much. I also wish you the best. So I
Thank
hope
you.
you have so much more success than you have now.
Thank you so much, Sergio. So see you on Monday and have a great weekend.
Thank you, Miss Encina. Sending you a big hug and see you this Monday.
The same for you. Take care. Bye bye, Sergio.
Bye, Miss Encina.